Every year between October 15th and December 7th, millions of Americans face one of the most important healthcare decisions of their lives, the Medicare Annual Enrollment period, also known as AEP. This is the time when you can review your Medicare coverage, switch between Original Medicare and Medicare Advantage, add or change prescription drug coverage, or simply confirm that your current plan still works for you. But here's the truth. Most people either don't take full advantage of this period, or they rush through it without understanding the details. The result? Higher costs, limited choices, or penalties that could have been avoided with just a little planning. That's why in this video, we're going to break down the 5 most important things you need to know before Medicare's annual enrollment period begins. By the end, you'll have the clarity and confidence to make the best decision for yourself or your loved ones. The first thing you absolutely need to know is that plans change every year. Many people assume that if they are satisfied with their current Medicare Advantage or Part D prescription drug plan, they don't need to review anything. But that's a dangerous mistake. Insurance companies are allowed to adjust their premiums, copays, deductibles, provider networks, and even the list of medications they cover, known as the formulary, every single year. What worked for you in 2025 may no longer be affordable or even available in 2026. For example, maybe your prescription blood pressure medication was covered at a low copay this year, but in the new plan year, it could move to a higher tier, costing you hundreds more annually. Or perhaps your favorite doctor or hospital is dropped from your Medicare Advantage network, forcing you to choose between paying out-of-network costs or finding a new provider. This is why reviewing the Annual Notice of Change document that your insurance company sends you in September is so important. It outlines all the changes to your plan for the next year, and it can help you decide whether to stay put or start shopping for a new plan during AEP. The second thing to understand is that the lowest premium does not always mean the best plan. Many advertisements and flyers will promote Medicare Advantage plans with $0 premiums or very low monthly costs. At first glance, this seems like an amazing deal. Who wouldn't want to save money on premiums? But you have to dig deeper. Some of these plans come with higher copays for doctor visits or specialists, higher coinsurance rates for hospital stays, or limited coverage for prescription drugs. Others may have smaller provider networks, meaning your current doctor may not be included. Imagine saving $30 a month in premiums but then getting hit with a $400 hospital copay or finding out your necessary medication isn't covered. The real cost of a plan isn't just the monthly premium, it's the combination of premiums, copays, deductibles, coinsurance, and maximum out-of-pocket expenses. So before you sign up for that tempting low-cost plan, you need to run the numbers and consider your health needs. A plan with a slightly higher premium but better coverage might save you thousands of dollars in the long run. The third key thing to know is the importance of comparing drug coverage. Prescription drug costs are one of the biggest financial concerns for seniors, and Part D plans vary widely in what they cover. Just because your medication was affordable last year doesn't mean it will be next year. Every Part D plan has a formulary, and these formularies are updated annually. Some drugs may move to higher tiers, others may require prior authorization, and still others might be removed altogether. The difference in cost from one plan to another can be shocking, sometimes hundreds or even thousands of dollars a year. That's why Medicare provides the Plan Finder tool on its website. By entering your medications and preferred pharmacies, you can see exactly how much each available plan would cost you in the upcoming year. It's not uncommon to find that switching to a new plan could cut your drug costs in half, especially if you're on brand-name medications. Ignoring this step could mean paying far more than necessary, which is why comparing drug coverage before AEP is one of the smartest things you can do. The fourth thing you need to know before Medicare Annual Enrollment is that your health needs and lifestyle can change, and your plan should reflect that. Maybe you were relatively healthy last year and only needed routine doctor visits, so you chose a plan with a lower monthly premium and higher out-of-pocket costs. But now, perhaps you've developed a new condition, or you're scheduled for surgery, or you need to see more specialists. In this case, sticking with your old plan could become very expensive. On the other hand, maybe your health has improved, and you're traveling more. If so, a plan with a broader provider network or nationwide coverage might be more beneficial. This is also the time to consider extras like dental, vision, hearing, or fitness benefits that some Medicare Advantage plans offer. These may not seem important when you're feeling healthy, but if you suddenly need a new pair of glasses, hearing aids, or dental work, having that coverage could save you thousands. The key here is to match your plan with your current and expected lifestyle needs. AEP is your chance to realign your coverage with your reality, not just your past. The fifth and final thing you need to know before AEP is that getting help is not only okay, it's often the smartest move. Medicare is complicated, with dozens of plan options in most areas and countless details to sort through. Trying to navigate it all on your own can feel overwhelming. Fortunately, there are resources available. The State Health Insurance Assistance Program, also known as SHIP, offers free, unbiased counseling in every state. Licensed insurance agents can also walk you through the options, though it's important to work with someone you trust who prioritizes your needs over commissions. Family members, especially those with experience in healthcare or finance, can also be a valuable resource. The bottom line is, you don't have to go it alone. Too many people stick with their old plans simply because they're confused or afraid to make a mistake. But with the right guidance, you can feel confident that you've chosen wisely for the year ahead. To sum it all up, the Medicare Annual Enrollment period is a powerful opportunity, but it requires preparation. First, remember that plans change every year, so you need to review your annual notice of change carefully. Second, don't be fooled by low premiums, look at the total cost of care. Third, compare your drug coverage, because formularies and prices shift yearly. Fourth, think about your current and future health needs, not just your past, and align your plan with your lifestyle. And finally, don't hesitate to get help. Medicare is too important and too complex to tackle without support if you're unsure. By keeping these 5 things in mind, you'll be in a much better position to make informed choices during AEP and to protect both your health and your wallet in 2026. So as October 15th approaches, mark your calendar, gather your documents, review your notices, and set aside time to look at your options. Don't let the deadline sneak up on you, and don't settle for a plan that no longer serves your needs. Medicare is not a one-size-fits-all program, and the right plan for you is out there, you just need to take the time to find it. If this video helped you understand AEP better, give it a thumbs up, subscribe for more Medicare insights, and share it with a friend or family member who might also be preparing for enrollment. And remember, your healthcare is one of the most important investments you'll ever make. Choose wisely, and take advantage of the opportunities Medicare offers during the annual enrollment period.